Good afternoon, everyone. Hey, welcome. It's good to have you. My name's Chad Erickson, and I'm the Vice President of Sales and Strategy at My Advice. And my gosh, we're so excited you're here. We know that your schedules are busy. We know that we have the ASCRS meeting, Askers meeting coming up next week. So even with that, Marc-François, thank you for making the time
Yeah.
today. I know that you're busy. We're all this prep for the conference and everything else going on. And so for people like yourself and all of our attendees say to carve out time is well worth it. And it tells me that the people really want to hear the message that you've prepared and the topic that we've put out is interesting. So, and I think it is, as you and I have discussed this ad nauseum. But for those who are here, welcome. Just to kind of set some more ground rules today, kind of let you know what's going on. We are recording this webinar, and it will be made available to you within the next 24 hours after this webinar. So if you want to watch it again, or you have members of your team who would benefit from hearing this, please share it. We want as many to see this as possible, and it will continue to live on. We'll get it posted onto our YouTube channel within the next week so that it'll be accessible to everyone as well. We are going to have a Q&A at the end and invite you to put your questions out there. I'll be moderating those, and so if you do have those, go ahead and put those on the chat area or the Q&A section. Both of those are available, and we'll gladly take those. Again, thank you for making the time. Let me now start by just reading a quick bio of Marc-François Bradley, who is here with us today. So Marc-François is the CEO and founder of Sophrona. He started his career in retail software systems, where he worked as a programmer, business analyst, and product manager for a Fortune 50 company. After gaining an appreciation for the transformational power of technology and the supreme importance of the customer experience, he left his corporate IT strategy role. He's laughing like sometimes I have my bio. Sometimes I'm like, oh,
The
really?
supreme experience. Yeah. Yeah.
Supreme IT strategy role to start Sophrona. Uh, and I love this. It actually was a personal experience that left him convinced the patient communication needed to be modernized and improved through technology. And I'd love to hear that story. But hey, everyone, we're here to really talk about the future of ophthalmology practice growth, how the technology, referrals, and patient experience can really be enhanced. So, Marc-François, thank you. And excited to learn from you today.
Well, thank you very much, Chad, for having me here. And it's always fun to talk about this space, our space, and healthcare. And there's always so much opportunity, I think, for practices to improve, and so many challenges, and that's both can be, a source of difficulty, but also I think, for those who are here and for those who are curious about how to improve, there's always plenty of opportunity. And so here we want to talk a little bit about thriving. With some smarter strategies, we're going to be focused largely on referrals and how that can be a place to look. But I want to kind of ground a little bit our thought process here. I think none of these should be strangers to you here today, but the idea that reimbursements are declining, operational costs are increasing, right? I think I looked up that the average cost of someone who works at your front desk or scheduling is $20 an hour nationally, right? With it being much higher in some higher cost areas and only a little bit less in low cost areas. And of course, the staffing challenges that really continue since the pandemic. And what that points to, though, of course, is these opportunities that there is hidden revenue within your existing organization, right? Within your existing process, where it's not so much a matter of going outside of your organization and doing brand new things, but there are opportunities to look internally and look at how you can do things better, how you can improve the experience of patients and referring doctors, and how you can kind of change some of those relationships. And so we're going to look at that a little bit today. This is just fresh out of the Administrative Eye Care March 2026 issue, where Dr. Richard Lindstrom and Patty Barkley are kind of exchanging some ideas on the challenges of ophthalmology and practice and the opportunities for good managers. And something that I believe Dick Lindstrom started early on in his career was this cataract index, where he sort of correlated how many cataract surgeries it took to pay for a Cadillac. And while it's just an interesting yardstick, and you can clearly see here that, from what cataracts paid 40 years ago to what they do today, they're down to a quarter of the value. And while a Cadillac might not be as appealing as that special car you want to buy, it's certainly not gone down in price, right? It's almost doubled in that same time period. And I think this illustrates really well the idea that reimbursements are down and costs are up. And so, what we looking kind of specifically now at referrals as sort of an opportunity to uncover hidden revenue, where you do get referrals as a practice, or you're certainly in a position to get referrals. You've positioned your practice to be attractive to the world around you. Maybe you're leveraging all of the surfaces of my advice to have a good brand name and a good brand recognition in your community. These referrals are really oftentimes a source of leakage in your practice. Still today, we've been doing this for over 10 years now, really focused on referrals in eye care, but still today, for most practices, this is an area that's not managed as well as it could be, and that's really an opportunity. So we see that, whether it's because staff is short, or whether it's because patients can't be reached, or because the process is not well buttoned up, referrals don't get scheduled, patients don't get contacted, faxed referrals get lost. And what we find is that even in a practice who's doing a 20%, if we just look at cataract referrals, for example, which is typically the number one referral in ophthalmology practice, even at a modest 20% conversion rate to premium lens, we can say that roughly a two eyes per patient, each one of those lost referrals is worth $4,000. And again, in most practices, management doesn't really know how many referrals are getting lost in a given month, right? Because there's not really a great way to say, well, we got 100 this month, and we reached out to 95 of those patients 3 times. This sort of information is usually a guesstimate for even the best administrators. And what that means, though, is that this is also a $4,000 opportunity for each one of those referred patients. Moreover, if you often ask referring doctors, hey, well, what happens if I refer to your practice? They might say something like, well, it's crickets. They don't really know. They're kind of resigned to the fact that that's how they get surgery for their patients. They send them your way. Certainly every practice is sort of managing those relationships differently, whether it's with a liaison, whether it's with making sure your own surgeons and providers are going out into the community and connecting with referring doctors, whether it's through marketing. But generally speaking, referring doctors are sort of left in the dark, and it's not terribly easy to refer to you. It's probably on average not really terribly easy to refer to anyone. And that creates this opportunity for you that if you can do better on the process and do better on the communication, you can actually get some more of their referrals, right? They get so many cataract patients per month, they're referring them somewhere. How can you be the practice who gets all those referrals?
Marc-François, that's huge. I got a question on that. I mean, this is massive. So you talked about the practice administrators. They know what's coming in, but they don't always know what they're missing out on. You've been doing this for 10 years. So the practices that are most successful, what is it that those practice managers are doing to help them? I mean, maybe we're getting into that, with the next piece, but I think that's a critical element that we know it's there, but are they paying attention to what they're missing out on, and knowing, we call the KPIs, those key performance indicators, of understanding what they're missing.
Yeah. I think that candidly, a lot of practices a lot of administrators, even those that are, very well trained, have a lot of experience, have a little bit of a challenge with this, because referrals are coming in from so many different ways. They're being faxed EMR to EMR, so they're coming into the EMR. They're coming into maybe an electronic platform. They're, in many cases, they're still being put into a folder, and they're coming off of a fax machine, being printed on a folder. And so the best practices, of course, have made an effort to really communicate to referring doctors how they should refer, like, this is the fax number. We know calling is not the best way to do this. They've maybe dedicated a team within their scheduling team, who do who manage referrals. Maybe they have an electronic system for making sure all the referrals are ending up in one bucket. But most often it's sort of still fragmented. And this has been an opportunity for Sophrona really, and we'll see this in a couple moments, to create like a one single source of truth where everything is in one place. And there isn't really this question anymore of, did we reach out to every patient we got referred? I think the question that you're kind of hinting at is this idea, like for any administrator on this call or surgeon, would be, how do I know how many referrals came in this week? How do I know that? How do I go and can I figure that out? And I think that kind of gives you right away a sort of a sense on like, well, where are, is there
Right.
opportunity here? Because you're right that, here we kind of create this hypothetical uh, illustration, where a typical smaller practice may get 50 referrals per month, right? And the issue is not the demand. The referrals are coming in, right? And that's why we're talking about this hidden source of revenue. A typical practice is not scheduling 5 or 10% of those referrals. They're just sort of being, the person who's responsible for calling referrals on Monday calls in sick, and there's no one to call the referrals on Monday. And then by Tuesday, they're backed up, and so on. And so this is often what happens, where there isn't a very clear process. So if we kind of use our math here, what you find out is that for this practice, right, all of you attending here can kind of figure out, like, am I a 50 referral a month practice? Am I maybe only getting 25? Am I getting 500? Right. But the math matters here. And you're looking at $20,000 of lost revenue, which, is compounding every month. Right. So over the course of the year, it's happening without anyone noticing. Right. It's not because of poor care. It's not because of low demand. It's just kind of a visibility and a process problem. And so this is the sort of thing that we, highlight, right? And so again, as you're watching this, think about, like, what is this number for me? Maybe that 10% isn't, maybe that's too generous. Maybe that's too critical of your organization. And so what Sophrona sort of set out to do about 10 years ago, this was, actually born out of a joint venture with a large ophthalmology practice that wanted technology to sort of enable tracking and making sure referrals weren't getting lost. And I'll just give you a little taste here because this isn't a demonstration, but these are the things you should be thinking about solutions wise around, how can we make sure that the referrals we're getting are all being tracked and not being lost? How can we be a lot faster about, getting through the work that it takes? Because for large practices now, if you're getting 500, 1,000 referrals a month, now you're talking about a lot of work. That's a lot of outbound phone calls to patients that you need to keep track. Who did I call once and I still need to call again? You'll see a little bit here how we can create a much better experience for the referring doctor and the patient by getting the patient scheduled a lot faster, in some cases directly by the patient or immediately before they leave the referring doctor's office, and how you have kind of one place to look for all of this information. So, what we find is that with our technology, you might still say you will still have referring providers who will say, hey, I don't want to change anything I do. I just want to keep faxing you like I always have. Well, that's okay. We'll bring that fax right into our workflow, which I'll show you in a moment. Maybe those referring doctors do want to log in and they want to actually, they're a little more tech savvy. They want to fill out the information. They want to actually schedule the patient themselves and hand the patient an appointment before the patient goes home. They can make that appointment. And really all of this means that this is marketing, right, Chad? Like, I mean, it's kind of like a funnel where like everything comes in and you have different elements that qualify the different patients that are coming in. So, what you'll see, and this is just a little bit of a visual, but, you might have our Sophrona referral portal where a referring doctor has a login and their staff is logging in to, maybe they co-manage with you. They're going to log in to refer. They might still be pushing a fax through. They may have great web forms on their website, right, where I can actually submit a referral through. New with Sophrona now, they might also call in and talk to our AI phone agent, right? So referrals can come in all these different manners and all these different mediums. And we bring, these together into one sort of workflow dashboard where you can see, hey, this referral was scheduled. I don't need to do anything at all, right? That's the beauty of it here. We call this the happiest path. But the referring doctor made the appointment already. I don't need to do anything. But I do see it here in my workflow. Um, our clients who don't even turn on real-time scheduling, maybe they're opposed to it. Maybe they want to try things out before offering this. Just by having all the referrals work in one place gives them a 30% efficiency boost. Now this is talking about their team and how they're doing this. What it looks like really though, if I see here's a new referral that came in from the web, it's in a new status, and now we're talking about kind of the very, very quickly, just to give you a bird's eye view or a quick glimpse at the workflow. But now I've got someone in my scheduling team, they pull up the referral, they see, okay, there's a phone number I need to call. This referral was not scheduled by the patient, by the referring doctor, right? It came in as a web lead for a cross-linking exam. I call the patient. I can kind of make a note here in our workflow. Did I reach the patient? Did I get them scheduled? Which will sort of help us queue you up to call the patient again and again if you need to. And where we do reach a patient, right, or where we leave a message, we're keeping the referring doctor apprised of our efforts, which is really an important point, right? Because remember the crickets point. The referring doctor has no idea how good you are at reaching out to their patients, or if you did at all, right? Oftentimes they don't know you've seen the patient till they see the patient for a routine exam much later. And so this idea of helping your practice work through the referrals, being much more efficient, being faster, right, getting that patient scheduled, and keeping the referring doctor aware of your efforts are all things that sort of are integrated into the process.
So Marc-François, just as kind of from hearing this, so you mentioned this earlier, that the idea is to kind of get in front of this, and you don't have a people problem necessarily within their practice. They have a process problem where everything's coming in from multiple sources, and it's very difficult. So what Sophrona really is doing, if I understand it, is saying, "Hey, optometrist," as an example, rather than faxing or through snail mail or through Pony Express, referring somebody over or hoping, or giving them a business card, they're going onto a portal and saying, "You are here, signed up, you guys are connected. Go ahead and schedule an appointment today," if they allow that. But regardless, creating just a faster, better way that everybody's connected,
Yeah,
and you close that loop back to them.
Yeah, and it creates really kind of a wow moment for most patients, right? I mean, if you envision yourself having been referred recently or a family member, and you kind of
Sure.
know that point of like, well, am I supposed to call, or are they going to call me, or how long do I wait before I call? And you're already kind of uneasy about whatever. Well, what's the next step in my care, or what's going to happen to me? This whole idea of like the referring doctor taking the moment to book the appointment and hand the patient, Chad, I've taken care of you. I've scheduled you with a
Yeah.
specialist who'll take care of you. You've got an appointment next week at 5 p.m. on Friday. They fit you in. That's kind of like, that's a good segue to this slide here where, we can.
It's white glove. This is white glove type stuff now. Yeah,
Yeah,
absolutely.
yeah. Because now the patient's delighted. I mean, how often does that happen? The referring doctor looked good, and because you, as a surgical practice, enabled them to look good as really taking care of business. And for some of our better practices, like Boston Vision here on the left, almost half the referrals are being scheduled by that referring doctor.
Yeah.
And you think of the goodwill now the patient has coming into your office, where they've already had a better than average or an excellent experience just with the scheduling process because they didn't have to do much at all. You look at Panorama Eye Care here on the right. Now they've taken a slightly different model because they still have they still have a lot of referring doctors who maybe don't make the appointment at the clinic, at the optometry clinic, but the patient's immediately empowered to make their own appointment. They get a text message saying, "Hey, you've been referred. We'd love to get you scheduled. We've tried. We're trying to reach you, but if it's easier for you to schedule yourself, click here." And within a few clicks, they are scheduling 30% to 60% of the time they're making their own appointment, which is 60% of the time for cataract evals specifically. Um,
Huge.
and yeah, so there's certainly that component too, right, of building that experience. And I think if then we talk about the how this should be, right, it's this idea of making it easier. It's removing the obstacles for the referring provider. It's making it possible for them to schedule, like you touched on. It's creating sort of a high tech complement to high touch, right? With again, the back to one of your earlier questions, Chad. The best practices do show that they care, right? They are making sure they have someone who can call the patient. They are making sure that they keep in touch with referring doctors.
Right.
Um, but one of the back to kind of this crickets concept of like, well, the referring doctor sends you patients, but why send you more patients, or why would you be better to refer to than other practices? Surgical quality, outcomes, all those things. If they're even, um, it's this other piece where now we actually can show the referring doctor, well, what's going on with my referral, right? They can see, oh, okay, yeah, I see that this patient, this is from logging into our referral portal, but they can see this patient still scheduled in the future. That's why I haven't heard back from the specialist, from the surgeon. They haven't seen the patient yet. Or here are some patients that have been kept. And this really gets at this sort of no more crickets concept of, now I actually know what's going on. I can see that my patients are getting scheduled. I can see when my patients kept their appointment. I can see when they did get scheduled for surgery. And then I can also see the clinical data, right, which is actually quite important, because even though in theory practices are closing out an exam, hitting send the referral letter out of their EMR back to the referring doctor, that's still moving through fax. And unfortunately, fax is still not, you'll often get complaints like, well, I didn't get the fax. Well, then, that perception is everything at that point. It doesn't matter whether you did or didn't send the fax. If the referring doctor says that they didn't get it, maybe it was their equipment, maybe it was their staff. Um, Having the ability to look at the visit note at all times whenever they feel like it in an electronic format here ensures that they always have access. You do away with those complaints of lost faxes. And then,
When I hear faxes still, I'm like, I cannot believe that in 2026 we're still using faxes. It's baffling. My daughter works in a dental practice. She's like, Dad, we still use faxes. I'm like, are you kidding me? Like, this is so foreign to me. I thought those days expired, but I guess not. It's still there and it's still
no, it's
happening.
not. And I think, we often have this question, but I think what appears, it's still the least common denominator. And between different practices with different systems, it still is sort of the way to push information over. And and that's why really we built our platform to work with faxes. It wasn't the first thing we built, by the way, right? We had the real-time scheduling and the digital and all this, and then many of our clients said, yeah, well, that's great, but only half of my referring doctors will use it, so I'm still using two systems. Okay, well, we want to
Yeah,
be the single source of truth, so we have to
right.
we have access come in here. And I think AI, I think, some of our newest things like our smart fax AI reading, reads a fax and pulls the referral data out of it. It may mean that, faxing just becomes sort of a behind the scenes protocol, if you will, for moving data and that sort of thing. Um,
That's a great use case to use AI in that way, where again, automation behind the scenes that just makes it easier for everybody. It's a great way to use
yeah,
that.
yep. Um, and then of course, now the benefit is, going back to this challenge of visibility, is that if every referral is passing through this workflow and your team is working the workflow, you have a great way to kind of see what's going on at your practice level. And so that might mean, looking at, well, how many referrals came in over this time period? How many came in from a specific referring organization? That might be a local primary care group. It might be a specific optometry practice. You can kind of measure how they're coming in and really what's your team doing with these? Are we getting everyone scheduled? Are many referrals sitting unscheduled? We often look at, especially for elective procedures, increasingly, well-run practices are really looking at how long is it taking me to make that first contact point. I received a referral. Did it take me 3 days to contact the patient, or did I call the patient within an hour of getting that referral? And so having some of these, building off of this back, you start being able to say, hey, as a practice, these are going to be some of our key performance indicators, and what are the goals we set? How long is it taking actually to get a patient scheduled? What percent are we getting scheduled? What percent of these patients are actually turning us down when they were referred, despite the referral? Well, I changed my mind, or it's
Right.
going to be too expensive, and that sort of thing. So,
It's interesting, Marc-François, kind of thinking about that of you and I are in the business world as running companies, we think about what levers can we pull, right? And so, you hit upon one that I think is critical, and that is that time to respond. Some of the data I've seen is that 10 minutes, anything beyond 10 minutes, and the lead falls by like 400%. I mean, it's so critical that they are touched immediately. That outreach happens. And you think, boy, if I could just pull that lever and we decrease our find out what is your response time today, and how do you cut that in half, if or how do you get that down to that
yeah.
sort of that 10-15 minute mark, and watch what happens to your close rate and appointment rate to shoot up by just improving one element.
Well, I think that touches kind of back on the, part of the title of this talk, right, about the hidden revenue. And I think you're
Correct.
spot on that those are the, it may only be a very small tweak and just telling your team like, hey, give priority to referrals that are this type, or let's make sure
Yeah.
that someone's actually watching these, and this, you're on duty from 8 to 11:30. We want to, and it could just be simple things like that. Absolutely.
Yeah.
Um, the I think that's maybe that brings me kind of to the close of sort of this arc of looking at the inherent challenges, but also the fact that these referrals are coming in. You do have these are two assets you have referrals coming in, and you have referring doctors who are referring to you. And to the extent that you do a better job making sure every referral that comes into you gets scheduled and gets tracked, and actually has some method to how they're scheduled, and then the reward you get with referring doctors referring even more to you. We've seen data from some of our largest clients who've studied this, that they thought their best referring doctors were sending them all their referrals. Well, how come we got even more referrals when we started doing this? Well, no, they, now that you're clearly the easiest to work with and you share information, of course they're going to send you all their referrals. So those are two really areas that can help a practice in growth without doing too much differently.
I love this. So, what's great about this is I think first and foremost, what I hear and what I've learned from you, and as you and I've gotten to know each other over the last year plus, is that you are so focused on a great client experience and understanding that when I say client, but really it's the patient experience, excuse me, that that patient has a great experience, and that's the focal point, then the optometrist looks good, and the ophthalmologist practice looks good, and everybody wins. And you are creating, those wow moments. But I also think about it, I ran track, and I've coached track, and I think about those baton handoffs, and I would coach my teams on that, and I had those. But when that baton handoff is smooth, and
Mm,
you've seen those, right, at the Olympic level, when it is so honed in and it's so smooth, and you're like, wow, that was amazing. And it's great. Conversely, we've seen, in those same high pressure experiences when the baton gets dropped, unfortunately,
yeah,
right?
yeah.
But this is an opportunity to leverage a better process that's going to create a better patient outcome and make it where every single time we can have a baton handoff that is just it just goes, and it's just process driven. It's a simple way, and it's great.
Well, I think that's a very good metaphor, and I entirely agree with that. I think that the other thing that we have to remember is that um, if you're really thinking about patient experience, and there's been a lot more awareness with patient experience, because also, if we look at these premium lens, now I'm talking specifically about ophthalmology, but this would probably be true of any elective aspect of healthcare. Um, if you look at that sort of standard 20% conversion rate to premium lens, and people will talk about like what another source of hidden revenue, right, would be sort of like, well, you got the cataract patients that are coming in, like, are you really doing a good job educating the patient and making
Right.
sure they know they have options, and so on. What you start seeing is that conversion rate is proportional to the patient experience. How much do they trust you? How do they feel about the way you've taken care of them? How educated are they about the options? And if you think about how all that matters, and then you think about your first step of patient experience is sort of like walking in the door and being greeted. And if you're doing a great job with the referral, like where it was a smooth, you were confidently referred as a patient. Now you were confidently referred to Dr. Chad Erickson, and I walk into Chad, I'm already coming in with a lot of goodwill. If my experience is I had to fight to get scheduled and I was forgotten, I
Right.
felt forgotten in like I'm the dropped baton, right?
Right.
And you're coming in with a bad experience to start, and then the practice is sort of working from a deficit as opposed to with some goodwill already built in. So I think that's a great example of the opportunity for that good pass, and why that just sets you get momentum. Yeah, probably right. You
Yep.
get momentum out of the
Correct.
baton pass. So yeah,
It's powerful. I love it. Well, Marc-François, we got a few questions. Are you ready for a few questions?
yeah, let's go.
Okay. The first one I can answer. The request is to send a replay to people who registered. The answer is absolutely yes. Anyone who registered is going to automatically receive this. So if they missed it today, it's there. And then also for you who are attending, you are going to get a copy of that as well. Feel free to share that link with any of your colleagues. Anybody in the office, you're like, I know who needs to hear this. Send it over to them, please. Would love for them to be able to watch this, or any consultants you're working with. Question: does this platform house a list of referring providers? It is based on how the referring provider enters the name, or can we also edit providers ourselves? Free texting provider names tends to create duplicate name, creating inaccurate reports. How can we avoid this? Does this also work like a CRM tool, or we can send other messages like a newsletter to the referring provider list? There's a lot of
Oh,
good questions in
yeah,
there.
good questions. Good questions. So
If I
the
need to repeat any
CRM
of those, let me know.
question.
That's a lot. So
Yeah,
yes.
hopefully I can. I think some of these. So the CRM question is a little bit more straightforward. In some sense, like people do, you're right to think like, oh, this is a little like a CRM because it's going to make sure we follow up with the patient, get them scheduled, and we're going to be prompted to call them again and that sort of thing. Um, but it's really focused on that referral and that referring doctor and sort of the sharing of information on the referral. So no, today we sort of point our clients to other CRM to pure CRM vendors that will sort of handle all the messaging that goes to direct to consumer kind of communication, as well as to referring doctors. So there is no outbound relationship management component with the referring doctors here. Not today. Um, and then in terms of managing referring doctor data, I think that's a great question, and it is a challenge. Our approach is really to mirror what practices do in their practice management system. So if most practices are flagging, or trying to, anyways, I should clarify. It's not always done very well, but are trying to flag, patients with referring providers, and so they add the referring providers to their practice management system, and so we kind of piggyback on that and say, okay, we'll pull in your whole list of referring providers as they exist today, and sometimes that data is really good and really clean, and sometimes we have to kind of clean it up a little bit ourselves. um, and then it does become a on as it is, we don't really change that equation, and that practices still will then have new referring providers they need to keep adding to their practice management system, and then we sort of synchronize, right? We piggyback on what's in the practice management system. um,
Yeah. I think that's good. Yeah, it's like anything, garbage in, garbage out in the software. And
mhm.
so someone's kind of watching this, and I think that this person, it sounds like, has had some challenges where sometimes people put things in, you get duplicate, pieces that are in there, and so creating an easy way for that to be cleaned up at the same time.
Yeah. And we are making some efforts as a company to try to synchronize with other data sources beyond what you have, right? To sort of try to help clean up data. Yeah, but it is a challenge. I mean, again, in eye care especially, you often do have referring doctors who will, work one place, during the week, and then they work from a Costco optical on the weekend. And so they
Right.
actually do exist as two referring providers in the system. So yeah, so it's a challenge. It's a great question, and stay tuned for improvements coming from us. But today it's mainly that we synchronize with your practice management system.
Yeah. And thank you for that question, those questions. Marc-François, I got a question. What's one change practices can make in the next 30 days to strengthen their optometrist referral network?
I think I'd say reach out with a survey and ask, a variety of questions that you think pertain to you. Like one question might be, I mean, now it sounds like a leading question, but like one question might be like, hey, how can what's your perception of how communicative we are? Like, do we keep you in the loop on things? How responsive are we? Would you be interested in using a platform to better communicate? So I think a survey is, you know, I think a survey is always a good way to show, interest and caring for a relationship because you're asking for feedback. Um, that's probably a more actionable type thing. If you have a liaison or you have someone inside your office whose role is supposed to be some degree of outreach, then I think that for them, then it's a little bit more about making sure, like, do they really have a plan for this month's communication, right? Where they actually aren't just uh, arbitrarily sort of choosing on a route to visit, but they actually have a plan for covering a certain, a specific. If the challenge is 30 days, in 30 days, how can we reach out to our thinking about the 80-20 rule, right? How can I reach out to the 20% of referring doctors who send me 80% of my referrals? How can I make sure I've reconnected with all of them this month?
Perfect. And thank you for that insight. So very, very helpful. Well, as we wrap up today, again, thank you, Marc-François, for your insights. So important, and being able to share this, I think, with this audience is fantastic, where they just understand that there is a better way. There's a great automation way that really does bridge the gap. And you had a slide on this. We don't want to lose that personal touch, but this adds in a way to make it with a tech touch aspect that improves process and will improve the customer patient experience. And we are in that business of doing that. So anyway, that's fantastic. For those that are going to be attending Askers, if you'd like to schedule time, either before that or at the meeting, you can scan the QR code. Marc-François has also put their email and phone number on here, so feel free to do that. And they'll be at booth 962 in Washington, D.C. We'll be out there as well. We invite you to come say hello to us when you're out there. I
Yeah.
love looking. It's always good to connect in person. We love it. So anyway, to everyone, again, thank you for attending. Marc-François, thank you. And we look forward to seeing everyone in the next couple of weeks at the meeting. So
Yeah.
until then, take care, everyone.
Thank you.